This podcast is provided with the understanding that it does not constitute professional medical advice. The information presented on this podcast are my own personal views, opinions, and summaries of research. Always consult your physician regarding any medical concerns, conditions, or treatments. Hello, and welcome to episode number 2 of It's Not You, It's Me, a PMDD podcast. I wanted to start out with something kind of fun right off the bat this episode. I recently read a journal article about PMDD that I plan to discuss in a bit, but it was surprising that this review opened with Dolly Parton lyrics. I had no clue that she had written a song about PMS back in 1994. It's called PMS Blues. I had planned to include an audio sample in this episode, but because I have listener support enabled on Anchor, I'm not allowed to do it, but I will share a link to it on my Twitter feed because I think it's definitely worth watching. And when I searched for the video and also mentioned the article, I learned that Mary J. Blige also wrote a song about PMS. Now, as you may know, PMDD is like PMS's evil twin sister. So though Dolly's song is about PMS, a lot of the lyrics are still pretty relatable. So since I can't play it, I thought I would read a couple verses from the song that I thought were really great and that I wanted to share. So here we go. I don't even like myself, but it's something I can't help. I got those God almighty slap somebody PMS blues. Most times I'm easygoing. Some say I'm as good as gold. But when I'm PMS, I tell ya, I turn mean and cold. For these teeth a-clenchin', fluid retention, head a-swellin', can't stop yellin', got no patience, I'm so hateful, PMS blues, premenstrual syndrome. Got those moods a-swingin', tears a-slingin', nothing fits me when it hits me, rantin', raving, misbehavin', PMS blues. So if you have a couple minutes, I would definitely check out the song. It's pretty good, and come on, it's Dolly Parton. I love Dolly Parton. Love 9 to 5. That's like one of my favorite motivational songs in the morning. So the article that opened with these lyrics was from a 2018 Journal of Gynecology in Canada titled Premenstrual Dysphoric Disorder, Contemporary Diagnosis and Management. And from what I gathered after reading it, this piece just kind of wanted to give an overview of information regarding PMDD and kind of what's, I guess, been the more recent news and research. It wasn't about a study that had been done. They didn't report any results, any, methods of participation and evaluation, just kind of discussing diagnosis and treatment about PMDD. I learned a few new things in reading this article, one being that the early term for PMS used to be premenstrual tension, which I totally understand, the whole tension thing. The term premenstrual syndrome actually didn't come around until the 1960s. So thinking in terms of family, probably shortly after my mother was born, that the term premenstrual syndrome started being used. The two doctors that authored this review mentioned that earlier studies and research often stated that 3 to 5% of women in reproductive age experience PMDD, but that due to stricter applications of the criteria that's needed to be diagnosed, which I talked about in my first episode, the criteria listed in the DSM, or also known as the Diagnostic and Statistical Manual of Mental Disorders, the numbers are actually more like 1 to 2% of women experiencing PMDD. Another thing that was new to me is that women who are pregnant and breastfeeding are not found to have PMDD. So as long as there's this cyclic ovarian hormone activity, PMDD can be present. If it's not there, it's usually not present. Similarly, there is no PMDD present in menopausal women, both those that have gone through it naturally and surgically. So it's that cyclic nature of PMDD symptoms that's what's crucial to getting a proper diagnosis, since the symptoms can sometimes present themselves as other psychiatric disorders, which this is why recording symptoms can be such an essential tool when talking to your gynecologist about possible PMDD diagnosis. In this review, they mentioned a tracking tool called the 21-item daily record of the severity of problems that was designed with the DSM criteria in mind for PMDD. And there's also this other tool called the Perspective Record of the Impact and Severity of Menstrual Symptoms Calendar, which saying that out loud is totally a mouthful. So it's also known as by its acronym as the PRISM calendar, which I'll be sharing the link for on my Twitter feed as well. And this calendar link was noted in the article. I went to it, I checked it out. It looks a little nuts. If you don't like spreadsheets, don't like big charts, you probably don't want to look at it. It looks a little crazy. I don't know if it's something I would use. If you prefer working electronically, there is an app by Me versus PMDD available to download for Android and iPhone to track your symptoms. Personally, I never formally tracked my symptoms, but when I first began talking to my gynecologist about everything, I had at least paid close enough attention to the time frame that I was getting the symptoms in relation to when my period would start. And it's so funny, I mean, kind of funny, not funny, I guess, depending on your thoughts on this, but I can vividly remember describing to my gynecologist the rage I would feel, that rage symptoms, in terms of the degree that I wanted to physically injure people. Now, don't worry, I've never acted on that rage, I've not hurt anyone, but that's how PMDD makes me feel. I have these thoughts like, oh my God, I really want to punch this person in the mouth or throw a plate in the direction of their head. With all the research and reading that I've been doing lately, though, about PMDD and being more aware of my symptoms, I'm able to better kind of stop and do a little self-check, like, okay, this is the rage you're feeling right now. Just take a deep breath. As much as you want to say something or do something, just, calm down, wait a little bit. I know it's going to pass. And I don't know, I guess you can say I just kind of tough it out. And I would like to talk about the treatments that are mentioned in the review, but I think I'd prefer to save them for future podcasts. We can get more in depth with each of them. So I can just briefly run through them now. They are lifestyle and diet changes, complementary and alternative therapies like acupuncture, cognitive behavioral therapy, which is also known by its acronym CBT, symptom-based therapy, hormonal contraceptives, serotonin inhibitors, ovarian suppression, and surgical treatment. Now, in terms of a cause for PMDD, the two authors share that experts have come to the conclusion that, quote unquote, altered sensitivity to normal hormone changes is what causes the symptoms to present. And these hormones include progesterone, estrogen, and serotonin. As I mentioned in that list, serotonin inhibitors is one method of PMDD management. But if you have found a treatment or a combination of treatments that has worked for you, I would love to hear about it. You can message me on Twitter at PMDD Podcast or send me a voice message via the Anchor app. I appreciated that this review wrapped up saying that the way PMDD can affect daily functioning should not be underestimated. And they also advocated that further studies are needed to find true accurate methods of diagnosis and treatment because, to quote, this condition can be as disabling as a major depressive disorder. In many of the readings I've done lately, that kind of seems to be the trend now, which is really nice to see and offers some hope, I think, that they are not dismissing this as, this is just all in your head. This is really nothing. It's like, no, this is actually something that is going on with women. We don't really know what is happening. We need to do the studies. We need to find a way to better treat them, better manage. And it gives me some hope, like that maybe one day a magic pill will be developed to help with this, or that they'll know the right combination of vitamins or supplements or, acupuncture, massage, whatever, to help with these symptoms. Because disabling, I have a little bit of trouble with that word. I don't know if that's the word I would go with. It definitely, I think, inhibits daily functioning. Doesn't total disable me. I am trying to be better when I'm mindful of my symptoms. Like, for example, last night I was feeling that kind of haywire brain thing going on. Like I knew I would not be able to focus or concentrate on anything that needed focus. So, my boyfriend's playing a video game. He wants me to play with him. And I know that if I would have just been acting really pissy and really irritated and annoyed. So I just, I took a step back and told him I can't right now. Like, I don't have the focus I would need to do this. And luckily, he's very understanding, and I'm constantly reminding him, or not reminding, but like explaining to him when I'm having PMDD weeks or a bad PMDD day. I just let him know so that way he knows it's not him, it's me. That was actually a nice little segue into this next section where I wanted to talk about why I named my podcast It's Not You, It's Me. Because I realized it might sound like a little bit of a strange choice, but there is a reason why I chose it. I feel like when I'm going through my PMDD weeks and I'm throwing around attitude, I'm acting irritated, annoyed, angry, tired, that those around me and the people I interact with, whether it's at the grocery store, the gas station, or a coffee shop, that they may ask themselves, like, whoa, what did I do? And may feel like I have a personal issue with them. And that's the thing. For people surrounding women who suffer with PMDD, it's nothing that you did. It's not about you. And that's often my apology and my reminder to my wonderful, understanding partner that it's not you, it's me. And I think patience and understanding are the two most important traits that a person can have in knowing a woman with PMDD. We're going to get angry for no reason. Then next second we'll feel like crying. We'll feel like crawling up into a ball and hiding away. We'll want to break something and feel like all is lost. We'll want to sleep, but we'll also want to eat a whole damn cake. But these feelings eventually pass. When I'm explaining PMDD to someone who has never heard of it, I often describe it as a Dr. Jekyll, Mr. Hyde, or a Hulk, Bruce Banner type of scenario, that my moods can change from day to day, hour to hour, and even minute to minute. The little things that wouldn't normally bother me will bother me, and it just like sets off this fire inside. Last month, what did it was I had, I think, just gotten back to work from the weekend and found that someone had watered one of my plants, which, generally a nice gesture, like, oh, great, that's awesome. But because it was my PMDD week, I wanted to throw my planter. I wanted to put up signs like, no one water my plants but me. Like, it just felt like this epic magnitude of a problem. But then after about 10 minutes, I was totally fine. Like, it passed and I was okay. And it's only been within the past couple of years that I've been opening up to people about PMDD and being more willing to talk about it and educate people, because not a lot of people have heard of it. And I'm trying to be better about giving myself space when I am feeling the symptoms and saying that it's like okay to give myself a timeout. If I know I'm going to be angry and kind of being a brat on purpose, that it's okay to be like, no, I'm going to stay home, or I'm going to go to the bedroom for a little bit until I feel a little more on an even keel again. Thus, there was a method behind the madness in the name that I gave my podcast, because, people around women with PMDD, you're just going about your everyday life. You're saying hello, you're offering, a piece of toast, but it's us, it's what's going on inside of us that is super pissed that the toast doesn't have enough butter, or, just weird little things like that can, or, not even instill or result in an angry feeling, but maybe make us cry. It can be different from person to person and different from on the symptoms from minute to minute. That about wraps up this episode of the podcast. If you have any questions or comments, thoughts about the article that I talked about, the one that I read, or questions about my podcast, questions about me, feel free to send them to me via Twitter, PMDD Podcast, or you can also send me voice messages using the Anchor app. Thanks for listening, and I'll talk to you all again next time. Bye.
The podcast you just heard was made using Anchor. Ever thought about making your own podcast? Anchor makes it really easy for anyone to get started. It's a one-stop shop for recording, hosting, and distributing podcasts. Best of all, it's 100% free. Sign up now at anchor.fm/new. That's anchor.fm/new to get started.